STIs matter. So just for simplification, I'll just be using certain terms interchangeably. So when you hear me say STI, I'm referring to sexually transmitted infections. When you hear me say AMR, I'm referring to antimicrobial resistance. When you hear me say CDC, I'm referring to the Center for Disease Control. So STIs are common, especially within the ages of 15 and 24. There's such a high rise these days, especially in our country, Nigeria, and that is our focus, even as we stand as a global contender. And these STIs, like gonorrhea, chlamydia, syphilis, they are increasingly common nowadays. Before, STIs didn't used to be such a common occurrence, but now we have so many more cases of STIs, especially in the younger age groups. And the real threat that we have is drug resistance. For most of the patients I see, I mean, a couple years back, with just a single dose of certain antibiotics or a week's dose of certain antibiotics, certain infections would resolve. But nowadays, we're finding that there's either constant recurrence or there's no resolution of the disease to begin with. And so that's why we're looking at how AMR in STIs is gradually turning most of the infections we could otherwise treat before into infections that are no longer treatable. And we're beginning to need to look for other options, and it is becoming a serious public health risk. So, as students and as young professionals, you are at the heart of AMR. You are at the heart of changing the narrative, and you are at the heart of the research that will go into turning the awareness that people have into actual action. Can I please have the next slide? So this is us looking at antimicrobial resistance in STIs. As you can see this graph, this is a graph we got from the Center for Disease Control, and you can see that there is a trend. We're looking at the trend between 2008 and 2021, and just checking to see how the different diseases increase and how the HIV risk also increased in tandem or in response to the increase in other STIs. So you can see somewhere around 2008, you had about one for gonorrhea, it was just like 150, a little less than 150 for every 100,000 people. And we saw that during COVID, somewhere around 2020, it rose. And you can see that there's an upward trend. It's just going up, rose to somewhere around 150 and went through the roof. And so this is one of, or this is, these are some of the real life trends we're seeing now. It's no longer the way it used to be where, you know, with treatment, there's a decline. You also see that HIV, was up, started to come down, and somewhere around 2015, it started peaking again. And we see that between 2020 and 2021, it went from about 30 to somewhere around 35. So you see that STI related AMR affects sexual and reproductive health and increases HIV risk. And it also adds to the economic burden. If you've been following most of the health news, you will know that the US aid was recently withdrawn for patients that have HIV. So there's no longer free medications for people living with HIV. I don't like to say that have HIV. So there's certain ways you put certain conditions so that you respect the dignity of people. So they don't have HIV, they're living with HIV. So this is a real concern. It's a real public health concern. I mean, think about it. Without the right action, even if you are aware, you're very likely to be, to be caught in this whole web. Can I please have the next slide? So this is what the question is asking. Why does it affect us? Why does it affect you as students? Why does it affect you as future professionals? And that's because we are the next doctors, the next lab scientists, the next microbiologists, the next pharmacists, the next public health workers, the next researchers. And unfortunately for us, it's happening in our generation. So we are the ones that are going to have to deal with this problem, and we somehow have to come up with a solution. And so there are different levels at which you can create impact. There's individual impact, you as a person. There's, impact at a population impact where you're able to mobilize people. And then there are certain considerations you must take into account because we do need a voice that will help us to actually localize global solutions. So most of the time you go abroad for internships, you go out for, you take hold of these opportunities, you travel out of the country. You're not traveling out for the pictures. You're not traveling out just to say, oh, I went and participated in a research and I did, XYZ work. You're traveling out so that you can go and see and begin to brainstorm and think of innovative solutions to help the African population. Because it's useless if you have solutions that you cannot use locally, that appear to be globally, problems that appear to be globally solvable, but we're still living with the problem in this time and age. So the different ways that you can contribute, through local research, you can, think of innovative ways around tackling the problem of AMR in STIs and even advocacy. So sometimes you don't have to be at the forefront, but lending your voice to policies, to the implementation of those policies, to laws is also contributory work in its turn. Can we please have the next slide? I'll just need to take a 2 minute pause here, Mr. Emmanuel. Please just give me 2 minutes.
All right. All right. All right. Please let's stay abreast as we wait for our facilitator to come back again. So sorry. I guess she has an important engagement presently. We could notice that there's a sort of a background noise.
Hello, I'm so sorry. Trying to sort out certain things. I do apologize. Please bear with me. So as I was saying, can you still hear me?
Yes, yes, I can. Yes, we can.
Okay. Okay. So this is why I would like to think that this is why I'm here today. So I personally am somebody who has focused most of my efforts over the years into advocacy. I sit on a board, a US-based nonprofit board, where our main focus is on sexual and reproductive rights justice and even contraception care to ensure that we're educating young people and empowering them to make the right decisions. But you can choose other paths. Like I said, innovations, local research, other ways to actually contribute other than actually doing advocacy work. So you can make AMR and STI research your project or your thesis. And these are just a few topics I was able to look at. I have some colleagues who have been participating in the same research and are interested in this same field. I'm sorry, there's lots of background noise here. And are interested in this same field. So you can look at surveillance of drug-resistant gonorrhea in local clinics because, like we examined, we saw that syphilis, gonorrhea, they're all going up. There's an upward trend. It doesn't seem to be declining. You can also look at the awareness. You can create awareness campaigns on STI treatment adherence. You can evaluate self-medication practices among students. So I say this, but for a lot of us, especially medical students, and when I say medical students, I'm not saying those in medicine. I'm saying if you're in a course or studying a course or a program that fully focuses on um, the healthcare sector, whether you're a biochemist, you're a lab scientist, you're a microbiologist, you're a pharmacist, you're an anatomist, you're a physiologist, you're a medical student, you're a nurse, you're an ancillary professional, you're an environmental health specialist, we have a bad habit of learning to prescribe drugs for ourselves. I have patients that come in and say, "Hey, Doc, I took the normal antibiotics." And I'm like, "You took what normal antibiotics are those that you took?" So these are some of the areas that if we were able to do some more research into it, because again, Nigeria is a country that has very low statistics. Every time we talk about topics or every time we talk about health concerns, there is always the concern around, oh, we don't have enough statistics to prove our point. So you can also look at antimicrobial stewardship in sexual health centers. Go and do research, do feedback, find out, do they have Is it does the center just give out medications at the slightest, or do they actually do proper physical examination to know what the problem is? These are some of the concerns or some of the areas you can choose to examine, or you can choose to make your thesis. They are suggestions, but you can carve out a niche for yourself. So please remember that these are just basically, you know, grains along the way to just show you, should you choose this kind of path, these are some ways in which you may want to explore, because there are probably areas that are untapped. We don't have so many people exploring these areas as of now, that exploring them would be beneficial to us as a country and still as a global contender. Can I please have the next slide? Okay, so we're looking at Nigeria and the AMR, the antimicrobial resistance in STIs. It is, I put there that it is a silent battle, but I will tell you for free, it is not, it's a not so silent battle. So it was a silent battle before. Maybe 2 years ago it was a silent battle, but as of today it's no longer a silent battle, and you're dealing with a lot more on the table. We have limited surveillance in terms of sexually transmitted infections. Many patients that come into clinics or that visit the hospitals or visit the pharmacies or visit chemists can hardly do any contact tracing, and many of the cases go unreported. And if they're unreported, that means they're undiagnosed or misdiagnosed. So these are some of the concerns that we look at. Also, over-the-counter antibiotic use without prescription is very common. So unfortunately, our country is, I wouldn't say it's lawless, but in terms of implementation, we have not done enough work. There's still a lot more that we can do. And we need to get to a point where even the commonest antibiotic is, restricted for the sake of our future and for the sake of future solutions to the future problem that we see that we may have to deal with. Because if we continue in this trend, I mean, think about it. There's almost no antibiotic that you cannot buy from a pharmacy. In fact, if you cannot buy from a small pharmacy without a prescription, all you need to do is to walk into a big pharmacy, look like a big boy, and they'll give it to you. So these are also some of the concerns around, the AMR in STI battle in Nigeria. Also, we have cultural taboos. Cultural taboos around STIs, they delay diagnosis and treatment. And this is something I've had to deal with, I've had to debunk so many times. In my work with advocacy, I have found that many people are, so quiet about their sexual and reproductive health. They don't want to talk about their partners. They don't want to talk about consent. They are afraid of speaking around boundaries. They don't even know who to run to in terms of seeking the right medical care. And so they settle for what they consume online, which a lot of times is incorrect or incomplete information. And so, again, like I said, your work does not always have to be research based, it can also be advocacy based. You can also be a voice for people. So my focus for me in SRHR is really having the conversations that people are too scared to have, the things that people are too scared to talk about. We talk about them. So we need to begin to clear the air, clear the stigma. It should not be. You should not be that you have an STI does not mean you're dirty or immoral. That you want to talk about STI screening, even in a committed relationship, should not be a ground for conflict. It should be something that should be embraced. It should be a conversation that should be freely had, where your rights are respected and that you feel that you're getting the appropriate care that you need. So you can work on so many areas. You can choose to work on, helping with policy formation. You can choose to educate people. Some people may be into environmental health education, health promotion behavior, health seeking behavior. Those are areas where your work will still contribute. So don't think of this as, yes, it's the AMR club, yes, it's a focus group, but at the same time, understand that there's so many ways and each one of you has a part to play. I personally am not such a research enthusiast, but I have been able to carve a niche for myself. And so I encourage you to think outside of the box, be innovative in thinking of what your path would be and what your contribution can be to the general fight. You can also do community outreaches. So maybe you have a heart for the people and you want to go out there and speak to them, or go out there and share medications or do proper diagnostic testing, have professionals go check them, investigate, do the physical examination and all that. These are ways in which you can contribute. These are ways in which you can you can basically amplify the work that you're doing because no effort is too small. The thing with advocating for people's health is you may not see the results until decades later. You may not even see it until you're posthumous. So some of the accolades you get or some of the contributions you make may not be recognized because leadership is not always in the loud moments. Sometimes it's in the very quiet moments. You may have only just extended a hand of friendship and helped someone who felt like they were battling with an STI. And that in itself is one already that you've already tackled one of the 100,000 people who are probably going to test. Can we please have the next slide? Okay, so now that we've talked about that, I just wanted to share with you a few pathways, to internships and fellowships and global opportunities that you have when dealing in the antimicrobial resistance and sexually transmitted infection space. There are a few global opportunities. I know that the WHO has a global AMR challenge, so you can look that up, research that, and see what opportunities lie there for you, and if there are things you want to, take hold of. There's also the Global Antibiotic R&D Partnership Program. Those ones, they have internships for young people, even if you're young students, young professionals. Of course, there are certain requirements, but again, remember that your work is, you have a contribution to make, and your contribution is not small, it's not menial. It may go unnoticed, but it is still a small drop in a mighty ocean. The CDC, the Center for Disease Control, also has a global health fellowship program that they run. And so if you might be interested in searching, again, these are global opportunities. And of course, there's React Africa and the Fleming Fund. I'm sure we all know Fleming, the guy who discovered the penicillins and the first antibiotics that we found. Although he went through a great deal of trouble to discover that and had to use it on himself to prove to people that in fact there were organisms that were harmful and they could be treated. Can we please have the next slide? Okay, so these are some local and Nigerian platforms as well. You may be, again, you may feel that you're not yet ready for a global opportunity, but again, I say do not close the door on that. Um, and if you feel that you're not ready for a global opportunity yet, you can start small, start from your local communities. The NCDC has an AMR program as well. The Nigerian Institute of Medical Research also runs something like that. And look around you. If there are affiliated research centers with your university. LAUTECH, they have centers where they run research, offer to participate in that research, offer to contribute. You may not have your name as part of the publishers of that research, that publication in the beginning, but over time, you can build a portfolio for yourself and you can build a strong image for yourself. So explore that and also look around if there are local NGOs that are working on sexual health or working on AMR.
That's very cool.
Also,
Um, are you done with this slide? Hello, can we all hear me?
yes, I think we as I said, You can attend STI and AMR related workshops, webinars, just like this one. You can attend, you can build relationships with your lecturers. Very sure when lecturers come, some lecturers are really, involved in certain levels of medical research. Offer to shadow them for a bit. Ask about what they're doing. Even if you're not interested so much, ask about their work. Say, oh, are you doing anything related to that? Ask them the questions. They may not be doing the AMR STI research, but they may know people that are actually doing it. And then you can volunteer with sexual health outreach programs. So if there are people that your local NGOs that help to, do the same work that you're doing, that's also something you can lend your voice to. You can you can volunteer with them for medical outreaches. Sorry, can you hear me?
Ye- yes,
Hello?
I can.
Okay. Okay, I'm so sorry. A call came through. So, you can volunteer for, sexual health outreach programs. You can volunteer for AMR programs. You can volunteer to participate. It can be as simple, and let me say it better so that you understand, so that it does not sound like I'm saying gibberish. When I say you can volunteer, it can be as simple as joining a research team to share questionnaires, helping them to speak to respondents, going there as a translator, because it's all in how you put yourself together. And now, why I'm saying this is with regards to seeking out the global opportunities that may be open to you. Every time you step out, you go into local communities, take a picture of yourself. You're talking to a respondent, take a picture of yourself. Because unfortunately, the world we live in right now is such a digital age that it is your digital footprint that matters. So if you tell me you've done all that work, it feels nicer to actually see the work you're doing. So participate. And again, you can start a campus AMR awareness campaign if you like. That can be something you just choose to do. You say on campus, let's create an awareness. We talked about the fact that medical students typically um, begin to self-prescribe and in themselves are abusing antibiotics and are also contributing to the numbers we're seeing in AMR when it comes to STI. So begin to create awareness around it. People say they know, but they're not actually taking action. So move that awareness. Let it not just be them knowing, oh yes, I understand that there can be AMR. Show them these numbers. Tell them about the statistics that you have at hand. Show them the impact it has. Show them these graphs. Let them know. Look at the trend. Look at how and it's good for you to also keep a very your interest in global health. It needs to showcase your interest in, AMR and STIs. It needs to showcase who you are. So we're not just saying you say your name, okay, Hadiza Thompson or Sweet Baby Jesus. It should be, and this is again just a part of how to package your media profile so that opportunities can locate you, so that people can reach out to say, hey, I came across your profile. Let it be that when we're searching out people that are interested in the AMR field, your name comes up as a contender. But it will not come up by you sitting and watching. It will only come up when you take actionable steps. Can you please have the next slide? Okay, so like I said, actionable step. Simple actions, but they have big impact. So stay informed about AMR trends and STIs. Around it. Ask who's doing research now. Ask who's interested in this. A simple Google search. A simple take a look at the news. What's some of the information you get? Because sometimes um even when health emergencies happen, that may be your opportunity. And a health emergency may occur, and that may be the one reason why a certain government decides to flood or to put so much of that field. And that might have been the opportunity you're just waiting on. But imagine that opportunity comes and you're not prepared, or you're not aware that the opportunity even came and passed you over your head. So you need to make sure that you're staying informed. Educate your peers about responsible antibiotic use. Let it not just be something you preach, but actually practice. So yes, let them begin to know you as the girl that always any drug unless you've tested and you've seen that it actually works. Don't take antibiotics over the counter. In the beginning, people may be like, "Oh, get off my case!" Like you always talk about this, but over time, you become known for that thing that you're always speaking about. When people want to look for people in that field of AMR, they are turning and they're looking. Oh, Mr. Emmanuel, you can. Yes, I know you're always saying this AMR. Oh yeah, oh, this is your opportunity. Come and use this opportunity. So those are, you want to make sure that you're staying on top of your game, and you don't share. I said, make sure that you're practicing what you actually preach and talk openly and sensitively about sexual health. So let's have the conversations that are the generations before us were too scared to have, but we have them in a way that allows. I say this, and this is one of the reasons why my I've been able to reach more people. Let your conversations about sexual and reproductive health and rights be age appropriate. Let let them be one that help to build people's confidence, one that help people to trust in you and trust in your expertise, and let them be what people can actually relate to. So we will not pick what is happening to a young person in the United States or in the UK or in Sweden or in some other country and come and start telling youth. We will look at what is actually happening in our country and relate it to the experiences of our Nigerians or our fellow Nigerians, the people that are actually experiencing these problems. We'll not talk in a way that makes them feel bad for opening up. Oh, you're such an immoral person. You don't even, can't you be discreet? No, allow them to feel comfortable enough to have those conversations should they choose to have them with you. And group that focus don't need to. You already have one here, right here. And like I said, this is such an untapped opportunity. And I just want to commend you, Mr. Emmanuel, again for setting this up and for founding this. And I think this is something that more people need to key into so that they get the right training and they open themselves up to the right opportunities. Please let's have the next slide. Okay, so like I said, further now, AMR crisis is as real as it gets. It's growing. It's now turning slowly into a health emergency. And you can contribute. You can contribute through research. You can contribute through advocacy. You can contribute through innovative ideas. You can contribute through your out of the box solutions. Like I said, don't sit and dream of it in your mind or think about it in your dorm room. Get out there, ask the necessary questions, take that step of just asking, are you doing any research on this? Have you found any people that are actually now untreatable? Are there ways in which I can contribute? Do you know any openings? Do you have any opportunities? Explore the ideas, connect with people, like I said, connect with teachers, with mentors, with your peers, and ensure that you're actually protecting because like I said, it doesn't have to be in the big things. It can be in the little things, in the little steps. Make sure that we can save antibiotics for future generations. If during Fleming's time they took all the drank all the penicillin, we would have not come to meet medications or drugs that would help us to treat any infections. So let's leave something for the people coming after us. Let's leave something our us. Can I please have the next slide? Okay, so and that brings me to the end. I do not want to take so much of our time. I was hoping we'd have the opportunity to ask questions. Any comments? Do you have any questions? Any areas that are unclear? If you want to share something exciting that you're working on in the same space, happy to hear that. If there are any challenges that you foresee that you may be running into or encountering, or if you even have a project idea that you think you'd like to get a little bit of feedback around, again, can I please have the next slide? You're free to reach out to me. You're free to ask even your questions right here. Mr. Manuel, can I have the next slide? And if you want to connect with me, this is my email address. You can find me on LinkedIn, and you can also find me on Instagram. Let's this together. And that being said, I think I will bump off from chit chatting and give Mr. Emmanuel the floor again. If there are any questions or any concerns, I'll be happy to answer them. Again, thank you so much for the opportunity to speak to you guys today. And I'm hoping that you learned a thing or two. And if you didn't, I'm hoping that you enjoyed listening to the session.
Wow, wow. I must say you gave in a lot to this. It's rightly encapsulated everything that we have envisioned should be delivered. It is rightly said. Every nooks and crannies of sexual transmitted infections in AMR, the public health significance, you showed it. How students or slash professionals can climb up the ladder, you showed it. And indeed, you really delivered. Thank you so much. I know you've given a reaction before, but you can try and give a reaction if you know you've learned one or two in this fantastic session. So thank you so much. So we would love to ask if there are questions, if you have questions whatsoever, and if there are no questions, maybe opinions, or maybe probably you are working in the same area also. All right. Okay. We have Dr. Abraham Alabi. Okay. Who else? Okay. We also have another question. Right. Probably let's jump on it now. Sir, Dr. Ibrahim Alabi, can you unmute yourself to ask your question?
So, good morning, good afternoon, good evening, well, depends on where you are.
Yes.
Really, I must say, this is a very good exercise. I'm joining for the first time.
Wow.
And not to take much of your time. Oh, Yelayo, I think we met at NAS meeting last
Yeah. Yes, sir. Yes, sir.
year. So I'm happy to join this discussion, really.
Wow. It's
And to Yeah, to our presenter today, Dr. Hadiza Thompson, thank you very much for an excellent presentation and very inviting, and it's really, really good for young people, particularly the most people on this forum that are students, really.
yeah.
You really lay the foundation and encourage everyone to really do something. And I think this is the message. So thank you very much for your excellent presentation.
Yes.
Thank you,
I would just
sir.
want to, yeah, I would just want to say also that for a while, and I did implement a program in Liberia a few years back, both on AMR and stewardship, which was
Mm.
published. In your presentation, you say you are not of much into research, or I think you are actually doing research. You are doing research and you are loaded, really. So maybe you just need to, if you don't mind, let's discuss and do a lot of this together.
Definitely, sir.
One
Yes.
thing I want you to comment on, really, because of the audience we have, which are also
Mhm.
part of the bigger society. You talked about STI. I just wanted you to give your experience in your practice. What are the commonest bacteria now? And in terms of treatment, how much of resistance do you see? I think this will be vital for this audience, really,
Okay.
to learn about that. Please, if you can just share your experience in this field.
Okay.
Uh,
Okay.
Once again, thank
Um,
you very much, and thank for you, Layo, and everybody on the platform. Thank you very much.
Thank you so much, sir. Thank you for your question. Mr. Eli, should I answer as they come, or
Yes.
do we wait for other? Okay. All
Let's
right.
for other people. I would take one other question, then you take the two together. Then if we have time, we also take other questions.
Okay.
Yeah, so I must say a big thank you
Okay.
to Doctor for joining the call today. I actually saw that you joined the call. I actually met him during my oral presentation at Nigerian Academy of Science. And Doctor is a fantastic individual who has lengthy years of experience in terms of antimicrobial resistance research, infection prevention and control. He's a Nigerian and he has traveled to some African countries to conduct research on antimicrobial resistance. Thank you so much for joining, sir. So I would highlight some questions here. Okay, the first
Okay.
question says that how can we leverage artificial intelligence and machine learning to predict and prevent antimicrobial resistance in STIs? How can we
Okay.
leverage by Ajayi Omotayo? How can we leverage artificial intelligence and machine learning in to predict and prevent antimicrobial resistance in STIs? So if you can answer the questions, the two together.
Okay. So the first one is how can we leverage AI? And you said what's the second one, please? Oh, okay. Am I answering the first and then the questions
Yes,
doctor asked?
I meant the comment made by Dr. Alabi about maybe probably your field experiences or clinical experiences in terms of sexually transmitted infections and AMR or thereabouts, and also that of Ajayi Omotayo. That's what I meant. Glue you, Gbadun. Kò ní cancel bọ̀ wọ́n á ti máa ṣe lọ báyìí ná. But
Most times, it's male gonorrhea we hear about because they have the symptoms manifested more. I'd say more like the head of the symptoms rears its head more aggressively or more viciously than when you're looking at the female patients. But I will say I have a lot of patients that come in with candida infections. In terms of the resistance, I will say currently, because again we must acknowledge the infections that in fact are beginning to show more AMR. And I will say Canada hasn't shown too much. However, there are lots of recurring infections now. So I typically will treat a patient and like maybe 2 weeks, 3 weeks later, they're coming back again with the same thing. Now, I know very well that that is AMR in itself, but it's that way because many of them, when these days, most of our doctors, we now write legibly. It's not like those days where you scribble it and you don't know what it is you're buying. You just have to take it to the pharmacy and get what it is that is dispensed to you. Nowadays, we write legibly, also for medical legal reasons and purposes, so that we're not misquoted in any situation. And you find that many patients who go and buy those drugs on their own, they begin to experience symptoms that are just like what they experienced the first time they have to run to the doctor's clinic. And then you find that if it happens again, which it's beginning to be recurring, they just go to the pharmacy and just buy that drug and come back and say, oh, doc, in fact, now you have patients personalize the infection. They say, oh, my yeast infection, it normally happens. And whenever it happens, I always buy my creams and I buy my drugs. And so a lot of times I have to re-educate them and say, hey, we are not sure that what you had again, what came back or what you thought came back was in fact candida again. This could have been something else. And so in testing is at the heart of what it is we do. I run a solely sexual health clinic, and I will tell you that not that many people get themselves tested. In fact, in serious relationships, they test at the beginning of the relationship and they don't test again till the end, failing to recognize that that is something you need to do regularly. So, asking a partner to get tested regularly does not inform mistrust, it only informs a great concern and a sense of responsibility for your own health. You cannot hold back because you fear that it will be sensed as mistrust. If you feel that even in a relationship where a committed marriage, or testing may be frowned upon, then that is a reason. It's a valid reason to begin to question your value alignment with that person. So one of I would say Canada is at the very top, and very closely following is gonorrhea, which you'll begin to see women come up. They go. I send them for maybe a vaginal swab MCS, and they're coming back and we're saying that whatever was cultured was gonorrhea, or it was Candida. And I would say Candida is at the forefront because now there's so many creams available, so many antibiotic suspensions, so many antibiotic tablets, pessaries, and what have you. And so the access is just there, and there's a lack of understanding of the importance of testing every single time. So if you have an infection every week, you need to test every week. It is not what you say, oh, this looks exactly like what happened last week. And so therefore, I'm just going to take what I was given by the doctor before. It's important to test again, because it is in that testing that we're able to even be more specific about sensitivity. I mean, a lot of, and unfortunately, even we professionals are to blame sometimes, because there's so much burnout. There's not that many people to handle the patient load and burden. And so you find that many patients, many doctors or many healthcare professionals, they write prescriptions empirically, which is in order, ask for tests in the beginning, and then maybe give you the specific ones after. But subsequently, there's really no regard for testing. And we just use empirical. Anything that happens, with like, oh, just use something empirical. Use something empirical. And unfortunately, that's what's killing us. Now, to the second question on how we can leverage artificial intelligence, I think you said, to predict and prevent antimicrobial resistance in STIs. That's the second question, right? Just so I know I'm on track.
Yes, it is. Artificial intelligence
Okay.
and machine learning.
Okay. So, as we know, AI now has become the order of the day, and it's beginning to be useful. I know a colleague who has been doing some research into maternal health and reproductive issues and infections as a whole, and dealing directly with AMR. And one of the things that she did mention is that now they're able to analyze more data sets. So instead of just, before maybe you have to do it a little at a time, but now they can analyze, you know, multiple data sets of patients, they can analyze multiple, data sets of epidemiological information that they get on the why, how, when, who, all the determinant factors of diseases. And we are now through that, because you're able to identify, you're able to analyze more, you're also able to identify where patterns are, because now you have so many more data sets, and you can actually look and say, look, there's a recurring pattern, or we say we did all the research we pulled from this region in Nigeria in between the year 2024 to 2025. This is what we came up with. Maybe 60 of them came up saying this was the most recurring one. And then we're able to now say, where do we begin to focus our resources? And we can even target and say, these are the high risk individuals. And that helps you as researchers to determine what the numbers are, and helps us as clinicians to say, now we can personalize treatment options or treatment decisions for patients. And that's obviously going to even increase, the discovery of more drugs, because now we know that, okay, this is probably the more recurring infection. We say, okay, let's begin to discover, are there any medications or any other drugs that we can test sensitivity on those organisms? And let's do clinical trials. And the more clinical trials we have, the more we can begin to detect early on what the next generation of antibiotics will look like for us. And in doing that, we're preparing for whatever public health emergency it is that we may have ahead. We're preparing the solution already from now. So these technologies, like I said, they just help you to detect the pathogens early, and they also help us to optimize antibiotic use. So they help a researcher to be able to say, okay, this is what we found. Um, this is most common. This is most commonly used, or this is the more sensitive one. And we, in making use of that information that has been pulled from those data sets are able to translate it into actual clinical solutions for patients and solve the bigger problem of AMR and SCS. So, like I told you, everybody has a part to play. And no matter how small you think your contribution is, or no matter how small you think you are, you think, oh, nobody knows me, or I'm just in this AMR club, I don't do much. You still have a part to play, and your contribution is valid. I hope I answered those questions without wasting too much of our time.
Oh, thank you so much. Yes, you do. Yes, you did. Thank you so much. Thank you so much. Yeah. The problem I have currently now is that I actually got logged off due to network connection problem,
Oh,
and the chats that the questions,
okay.
some of them.
Let me just read it to you.
Uh,
So the second question says, what are some effective strategies for promoting antimicrobial stewardship and reducing antimicrobial resistance in STIs?
okay. What's the next question? Is there any other question aside that?
Um, no, that's the only question I see here. Okay, are there groups you can recommend where people can volunteer for those of us that are not in school presently? I think that's yes, I think that's pretty much it. These are the questions that I'm seeing.
All right. All right. Thank you. Thank you. Thank you so much. Today was very, very engaging. Though this is the first time we'll be having a webinar or a session early in the morning on a Saturday morning.
Oh wow.
Usually for those of us in Nigeria. So I was so surprised for us to have people join from all over, and it was
Yeah.
really, really engaging. Thank you so much. And this is what I love, evidence based presentations. You're not just saying it, but then you've actually done it, you've seen it, and you've engaged in it, and that's what is actually very, very important. Thank you so much. So, and probably maybe like a take home, I want to make some comments that for students, if you take note of our slides, you notice that policy is actually very, very important also in AMR, in sexually transmitted infections. So you also as an individual, you can make this particular area your own niche. AMR in sexually transmitted infections. Not so many people are working there. Not so many researchers are working there. So will you be a sought after individual because they want to see, okay, what exactly is going on in AMR in sexually transmitted infections. So before even the meeting gets logged off, because you have just maybe about 3 minutes more thereabouts. So also you can try and start crafting policies in this particular area, because most of the time this is what reviewers look at. When you're submitting abstracts for conferences, on your conclusion section, make a policy. You can conduct a literature review in this particular area. AMR and sexually transmitted infections, maybe for people in Oyo State, or maybe for people in Nigeria, or people in Africa. So then your conclusion, you can innovatively look at a policy that you can draft out. So this is what reviewers look at, and you can be invited, or you can be accepted to present your research, and then from there you gain visibility, and from there all other individuals also gain interest in AMR in sexually transmitted infection, because I must say, I guess this particular area is still neglected. I don't think it has gained much visibility yet as it ought to. So you can actually gain interest in that. I don't know if our facilitator, Doctor on here, has maybe one or two before we go. I think this call ends in 1 minute.
Oh, well, just gonna say thank you again to everyone who's joined. Good morning, good afternoon, wherever you may be joining from. And let's connect. Let's keep this up. Let's keep talking. Let this not be the end of our interaction. Let's explore opportunities together. If you have any comments, like I said, I'm available via email. You can send me a message on LinkedIn. You can hit me up on Instagram, and I will certainly respond. And like keep stay informed, stay aware, and stay abreast of every opportunity it is that you can seize the day.
All right,
Have a
all right,
great weekend.
all right. Thank you so much, Doctor. All right, for everyone who joined
All
us, we
right
are
then,
truly, truly,
thank
truly
you.
honored to have you all here. All right, till next week or our next program, we'll be glad to have you. This program is organized by the AMR Club Lautech. Be glad to connect with us and stay informed on our WhatsApp platform for more updates. Thank you. Goodbye.